Can a general practitioner vet or a primary care vet do my dog's TPLO surgery? Back in the day, I've got to admit this, I'd have said I wouldn't choose that. I would just automatically go to a specialist because this is a specialist kind of procedure, right? I would always say it would be like going to my primary care doctor if I needed a hip replacement. Would I do that? No. Do I trust my primary care doctor implicitly? Yes, with a lot of things. But do I think he can do a specialized orthopedic surgery? No, and he would be the first to admit it. So that's why I would always say in the past, make sure you go to a board-certified veterinary orthopedist. And that does not mean somebody who says, I specialize in orthopedics. To me, that's misleading a little bit, and it might be completely unintentional on the vet's part. As the dog owner, we see the word specialize, and we switch it in our brain to mean specialist. They're not a specialist. Somebody who specializes in something doesn't mean they're board certified, or that they did the 3 extra years of schooling on top of vet school, that they published research, that they did a 1-year rotating internship. They probably didn't do that if they say, I specialize in orthopedics. You'll see DVM, and it means they're a general practitioner or primary care vet. If you see DACVS, and there are other specialty designations, the credentials, besides that one, then that's a specialist, a board-certified specialist. They've taken boards, very rigorous testing to prove that they're proficient in these various surgical procedures. So normally I would say I would only trust a board-certified vet. And then I met a vet, she's in Florida, and she's a general practitioner vet who does some of the best looking TPLOs I've ever seen, and I've seen a lot. I'm not a vet, I'm not a technician, but I can recognize a good TPLO when I see one because I've learned from vets. Lots of vets. Got you.
Thank you.
Dr. Main does these beautiful TPLOs that look like some of the ones that I've seen from my friends who are board-certified specialists. So now it's like I struggle with saying, well, a GP generally doesn't do as good a job as a surgeon. Kind of don't even know how to answer anymore because she's so good. I'll be unpopular for saying this maybe. A lot of times when I see some of the failed TPLOs, it's because, and these are not my words, but words from vets, they didn't do the surgery right. And the majority of times, it's a general practitioner vet who just didn't have the experience, or maybe the surgical decision making, like if I do this and this happens, then I rectify it with this, I fix it with this. Some people just don't have that yet. And that's why choosing your veterinarian is the biggest decision that you can make. It isn't, do I choose lateral suture, TPLO? It isn't, which is better, TTA or TPLO. That's not it. It's who's going to do my dog's surgery and are they going to do it right? And as I mentioned in a previous video, if you have a small dog, it becomes increasingly crucial that you find somebody who's proficient specifically with small dogs, not just TPLO. Small dogs have small bones. Every millimeter matters. So, yeah. Choose your vet wisely. All right, guys, if this video helped, go ahead to another one. And then if you're finding value in what I'm talking about, head to a playlist. A playlist is great because it just goes from one video to the next, and you can kind of binge watch a little bit with me, take me on a walk with you, to the gym, your car ride, whatever, and let's learn together, okay? If you have questions, go ahead and drop them in the comments section because that'll give me ideas of videos that I can make in the future, but also I can help you out with an answer. And if I don't know, I have plenty of vets I can ask. And if it's a technician type of question, I have technicians also. The other thing I want to say is, if you need an immediate answer, don't hesitate to call your vet team. They want you to succeed, because if you succeed, they succeed. If you do better because you have the answers you need to take better care of your dog, then that means their patient outcomes are better, means the majority of their dogs do well. So don't think that you're being a pain by calling. Of course, you don't want to call for every single little thing, but if something's concerning, yeah, give them a call. Let them help you and give you guidance, okay? All right, guys, you've got this. Take good care, and I'll see you in the next video.